Thank you very much for that gracious introduction. We have a lot to cover on the call today, so we're going to go ahead and get started. Now, everybody has a copy of the presentation material, so we're going to go through that page by page. So we're going to start with the first page, and really the title, Learning from HIPAA Enforcement, Avoid These Issues That Lead to Penalties. So if you go to the next page, we'll cover our objectives. So I always start out these calls with just some background information, a little bit of education on HIPAA, why it was created, who has to comply with the requirements, what the HIPAA rules are, who enforces HIPAA. We'll cover the penalties, and then we'll get into these enforcement case examples. We're going to see what other organizations did to get into trouble and resulting in penalties. So the goal of today is how do you get your organization's position to avoid these type of penalties? So that's why it's important we start with some basic definitions and some knowledge of the requirements. So when we get to the case presentations, it'll make a lot more sense. And then we'll finish up with being prepared for a HIPAA audit or investigation. What steps do organizations need to take to make sure that if they are audited, they're going to be able to provide the correct documentation that's asked for during an audit, or same if they're investigated due to a breach. So moving on to the next page, why is HIPAA enforcement increasing? Well, if you go to page 4, you're going to see some examples of medical identity theft cases, HIPAA breaches that have occurred. You know, regrettably, this is occurring at an alarming rate in this country. I follow the industry very closely, and almost every day there's another reported HIPAA data breach. So regrettably, for organizations that are required to protect protected health information, the U.S. Congress has really taken note of these breaches that are occurring and has really asked the U.S. Department of Health and Human Services, the agency that oversees HIPAA enforcement, to step up enforcement. They want to make sure that providers are doing everything they can to ensure that the American public has safeguards when it comes to their medical records and their medical identity. So again, like I said, this is occurring at an alarming rate in this country, and I think there's a lot of simple things organizations can do to better position themselves to protect health information. So moving on to the next page, just real quickly, what is HIPAA? We hear it all the time. Health Insurance Portability and Accountability Act of 1996. So what it did is it set the federal statutory basis for establishing these standards for the privacy and security of protected health information, acronym commonly known as PHI. We'll define that in just a second. So why was it created? Well, it was part of insurance regulatory reform back in the mid-90s. But more importantly, Congress is looking down the road, and they were seeing the dynamics in this country were changing a little bit. Gone were the days when individuals worked for the same company for 40 years, got their pension, got their health care, got their gold watch, and retired. Individuals are changing jobs more frequently, and that often meant when you changed jobs, you were changing health plans. So Congress was concerned, hey, how do we get the data from the old plan to the new plan, the portability piece of it, plus the advent of these electronic transfers of the health information. So not necessarily EMR or EHR, but the data was being exchanged electronically. Again, Congress wanted to ensure the American public had safeguards. So this is really one of the fundamental reasons why HIPAA was created. And if we move on to the next page that talks about HITECH, HITECH, it stands for the Health Information Technology for Economic and Clinical Health Act. And really what it was all about was to promote the adoption and meaningful use of health information technology. So if any of you participated in CMS's incentive program for meaningful use, this is where the funding came from for that program. But HITECH went on to address privacy and security concerns associated with these transfers of electronic health information that I just talked about. So moving on to the next page, which is the omnibus rule. This is the last or the most recent legislative update, sorry about that, to HIPAA. This was enacted in September of 2013. And in the page that you have, I just pointed out 3 areas that